Hi, welcome back to my channel. In this video, I will be discussing various pathologies that are given in oral pathology. So I have added a lot of photos so that we have some visual memory and we can easily remember. So I'll be covering it in I think two parts. So this is the first part. So the first one, you have to notice this particular thing. All right. So in this, what we see is there is a loss of epithelium due to rubbing, and it is resulting in a raw and sensitive area. All right, so what this is a Nikolsky sign. Now very important, in which lesions is Nikolsky sign positive is pemphigus, familial, benign, chronic, pemphigus, and epidermolysis bullosa recessive form. All right, so this is our first. All right, then coming on to the second one. Now in this second one, as you can see over here, we have a lesion, and then we rubbed off the lesion. Basically here we have scales. All right, then we rubbed the scales. Okay, just give me a second. We rub the scales, and then basically what you see here is a bleeding point. All right, so this is Auspitz sign, and it is seen in, most important question, it is seen in psoriasis. All right, now let's talk about the next photograph. Now in this photograph, you can particularly see this the thickening of the sternal head of the clavicle bone, right? So in this, you can see that it is the irregular thickening of sternoclavicular portion of clavicle. Okay, so this is what sign? This is the this is the Higo-Minaki sign, and it is seen in congenital syphilis. All right, over here also you can see there is thickening of the sternal head. All right, now let's talk about these signs. Now what happens is we see a carpal spasm, okay, in the photograph, right? So in this there is a carpal spasm after the application of pressure on arm by cuff of sphygmanometer. All right, so this is the carpopedal spasm. So this is the Trousseau sign. Then coming on to this photograph. Now here what you can see is that basically in this we are tapping the angle, and it is leading to the twitching of muscles on same side. So this sign, wait, this was fourth, and this sign, this is called as Schwartz's sign. Now both 4 and 5 are seen in tetany, that is hypoparathyroidism. Okay, now let's go forward. Now here in this one, fifth, sixth, you can see that there is ecchymosis on the post-auricular region. So ecchymosis on posterior auricular region over mastoid process. Okay, so this is most commonly asked in our exams. So this is the Battle's sign. All right, now look for the one in seventh photograph. Now in seventh, see, you have something as ecchymosis over the greater palatine foramen, right? So ecchymosis over greater palatine foramen. This is also asked. So this is Guerin's sign. All right, so what is this? This is Guerin's sign. Then coming on to the eighth. Now in 8th, what you can see is this, right? So this is ecchymosis on periorbital region. So this is called as raccoon eyes. Okay, now see this particular photograph. Now just focus. Can you see that this is normal? Like this is like going like this, right? But just wait. See, particularly over here you can see it going like this, the zygomatic bone, right? The orbital floor basically. But here what you will see is something like this. All right, now if I erase it, first of all just see again. Now you get it, the difference. Now I think you can make out yourself. See, this is normal and this is something like down. So this is what is called as hanging drop sign. Okay, and this is seen in orbital floor fracture. Now which muscles are herniated? Inferior rectus and inferior oblique into the antrum. Antrum is our maxillary sinus and it is best demonstrated on Waters view. Now do you remember what is Waters view? Waters view has two variations. One is 37 degree and 45 degree to orbitomeatal line. All right, then this is just to make sure if you have not gotten it from that. See, this is our normal orbital floor and see this teardrop sign, right? Can you see? Okay, now coming on to the, so this was our 9th. Now let's see this one, 10th. Now this is something we don't study much in BDS, but you can just know it. So see, first of all, this is our axillary region. Okay, itna to you can make out right from the photo. So axillary. Now see this is freckling. Now in axillary freckling, basically this is called as the crow's sign and it is seen in von Reckling-Hausen neurofibromatosis, also called as elephant man syndrome. Okay, now let's talk about this photograph in 11th. Now this is very common and I think you should know it. So first of all, just know that this is the upper right quadrant. Okay, and the provider is providing the pressure. Okay, now what happens is here patient feels pain on inspiration, positive. So this is our Murphy's sign. Now this is okay, you know this much. Now where is this seen? This is important. Cholecystitis. Okay, now last, then we will talk about others in next video. All right, so 12th. Now what you can see is they are basically eliciting a percussion, right? Eliciting a percussion. Okay, and what we see is there is like the tingling sensation is passed forward. Basically what I mean by all this is, see, so this is Tinel sign. Now what is Tinel sign? Usually this is the sign to indicate nerve regeneration. Now let's talk about it again. What happens is usually we have a nerve and it is divided, right? You have neuroparexia, neurotemesis and axonotemesis. Suppose axonotemesis or neurotemesis. So what will happen is like suppose this is our hand and this nerve is cut, so there is no passing of sensation. But after grafting or if the nerve is regenerating, suppose this is nerve that was cut and then new nerve is being regenerated, right? So what happens is we are able to transmit the tingling sensation to the peripheral parts right now, but here it was not possible. So this is the sign that tells ki the nerve is regenerating. All right, so these were the signs. I covered around 12 signs in this video and I'll be covering more in the next upcoming videos, and I hope this is helpful for you to remember, and if it is, kindly subscribe to my channel. Thanks for watching and I will post the second part in some time. Thanks for watching.